Hello and welcome to your introduction for the Enhanced Clinical Practitioner. So it's important to start off with just an explanation of what this is. So this is an apprenticeship. You'll be already a registered professional in some way. So you're already a registered nurse, registered with the NMC, the life pin, or you're registered with the CQC and you have a registration number. If you haven't got a registration number of some kind with a professional organisation, then this is the wrong apprenticeship for you. So let's just explain what this standard does. So this standard is the ECP, the Enhanced Clinical Practitioner. And you will probably know that if you've been looking, you do your degree at level 6 as a nurse, and then you kind of then go on to a level 7 master's as an advanced clinical practitioner. And then that opens you up to all of the fields of health, which can be quite a daunting experience and a very expensive one on that. I say that because I've recently undergone that journey and come out the other side. And I shan't tell you the fees that have been incurred on that. So this one's a nice standard because it's kind of in between the two. It's okay, I want to learn some more because I've had my NMC pin, I'm ready to upskill myself, but I just haven't got the time and I haven't got the money or whatever it is to go all the way up to the level 7. So the ECP works really well. And what we've done as part of our ECP, we've done a CPD program alongside it, so a continual professional development program. And what that means is you'll walk away with two parts to this apprenticeship. You'll walk away with your certificate, your CPD certificate, which looks at an ACP standard level of work, an advanced clinical practitioner's level of work, which is kind of the physical health module that you do in your advanced clinical practice. And in that, we look at clinical history taking, we look at ears, nose, throat, musculoskeletal, respiratory, cardiac systems, etc. So kind of the head to toe of you assessing a patient for the first time. Now, what's the difference between this level 6 and level 7? Well, it's to do with the level and depth of the knowledge that you need to have, but also you won't be coming up with full diagnoses on your own. You're going to be using that SABAR acronym to help you refer on. So situation, assessment, background, and recommendations. And you'll have enough confidence within your assessment skills to say, look, I've done a respiratory examination. I could hear wheezing in the lower left lung or the lower right lung, or I could hear crackling. And I could hear this, and the vital signs are pointing to this, and therefore I think they've got a lower respiratory lung infection, or perhaps they've got pneumonia, or whatever it is that you're diagnosing. And actually, I kind of request if we could have a course of antibiotics or whatever. So it's about you having more confidence in your clinical reasoning skills and about to escalate things. So early deterioration, recognizing that somebody's deteriorating and getting those earlier interventions in play. That's what you're going to be doing on the CPD side. But on the apprenticeship side, it's then the wider piece that goes all around that. So your governance, your supervision, your development, your wider understanding. And that's what we're doing here. So as you log in, you'll have your modules all lined out. And first of all, when we click in, we can see that we've got our occupational summary. And this really just covers everything that I've just said. The fact that this is, you know, a part of and are working towards that advanced clinical practice. An ECP works across a range of settings, across a range of professionals, all looking at therapeutic interventions. It works alongside our daily lives, and it just helps to embed some of those skills. We have 10 duties to cover. So over the months, and roughly we want a duty a month. We have our duty here, and then we have our skills, knowledge, and behaviours here. So our duty is to be an accountable professional, acting in the best interest of the person, putting them first and providing complex clinical care that's evidence-based, personal-centred, safe and compassionate. So in whatever we do, we're able to put them first, make a decision in their best interest, and to escalate that using that evidence-based practices. So NICE guidelines, best practice, etc. And as we do duty one, we're looking at knowledge 1, 2, 3, skills 1, 2, 3, and behaviours 1, 2, 3. And when we refer to these, we're referring to the skills, knowledge, and behaviours set out in the apprenticeship. So we'll have a look at those in a second. Duty 2 looks at using existing knowledge and expertise to enhance that clinical judgment, making a holistic assessment. Duty 3 looks at acting independently to plan, deliver, and monitor and evaluate that care. Clinical assessment, diagnostics, and interventions. Duty 4 looks at being an expert resource in your own organisation. 5 looks at develop, deliver, and evaluate education training opportunities to others, so upskilling your staff. 6 looks at communicate effectively to the challenging environments. 7 looks at promoting and encouraging innovative clinical practice to support a culture of excellence. 8 looks at lead and manage unpredictable and unplanned clinical situations. And 9 looks at those resource managements, and 10 looks at lead and monitoring. So that's what we'll be doing. But our skills, knowledge, and behaviours, so this is what you're going to be tested against at the end. So it's not going to be what you cover in your CPD element, it's what's in here. So here, your knowledge looks at those techniques, a systematic approach, and patient evaluation and evidence. So again, if we think about a systematic patient review, we're thinking about Socrates, assessing somebody from head to toe, which is a NICE guideline. Techniques to critically appraise evidence, such as local and national quality assurance, looking at your own practice, so looking at evidence-based practices, looking at your policy procedures and guidelines. Requirements for your ongoing professional registration and codes of practice. So this is about your revalidation process. So what kind of things are you going to be doing for your revalidation? How to appraise available tools, so making sure that whatever clinical interventions you're using are the most up-to-date ones. Understanding your anatomy and physiology, using those tools for evaluation, and so on. I won't read them all because they're here for you to run through. But this is the knowledge. Now, throughout the course, you'll be taught all of this. And then you have your skills. So actually, when we look at the skills, there isn't a clinical skill in there that says do in ears, nose, and throat, do a respiratory, do a cardiac. They're just enhanced skills that we're teaching you as part of this. But it is about doing and to be able to do a literature search, for example. So if we're teaching a technique, is that the best evidence? Appraising the evidence, provide enhanced clinical care. So that enhanced clinical care is what's relevant to you in your role. Okay, so that's what that is. Select available tools, look at different methods, undertake holistic patient-centered care, And then your behaviours, which we really expect you to embed and do throughout all of these, is to treat people with dignity, respect, show respect and empathy, and be adaptable, reliable, and consistent. If you haven't done functional skills, you need to make sure that you do functional skills. This is your English and maths. So again, you just log on here and self-enroll for your English and maths if you need to do that. When we look at the standards, it comes up with an endpoint assessment plan. So this is the current one. And again, here we can look at what's in the plan. So in your final assessment, which is typically 3 months after you finish, your first assessment method is a quality improvement proposal report and a professional discussion. So you won't be doing those clinical skills that you're learning. That's not what you're going to be assessed against. It's about you taking those skills and then implementing that within your practice and go, well, okay, how does what I'm doing improve the work practice? So for example, you can see here, you've got 2 components. You have to do a 5,000 word quality improvement proposal. So for example, one of those proposals could be improving better primary care access, because you're now able to do respiratory checks, cardiac checks, etc. And because of that, you're able to have quicker outcomes for the patients, and therefore them not being added on to a weekly clinic, which seems kind of almost indirectly discriminatory, where actually you could get an appointment same day if you wasn't in a nursing home. So it has to look at those. Now, I'm not going to cover all of this now, because actually we cover this towards the end. But your quality improvement proposal report is your first part. And again, you'll be given a timescale to complete that. And then component 2, which is the professional discussion, which is underpinned by your portfolio of evidence, demonstrating how you met the skills, knowledge, and behaviours. Your portfolio of evidence is what you submit to Canvas. So it's what's uploaded here. We just download that for you. So it's really important that you submit your work regularly. So when we look at those enhanced clinical practitioner behaviours, we're looking at building positive working relationships in the workplace. We're looking at respecting individuals' diversity. We're looking at valuing culture and needs. And we're looking at that protective privacy and preferences. So making sure really that we're working within our codes of practice, treating people with dignity. We need to show that empathy. And what we mean by that is we treat others with dignity and respect, regardless of their background. We actively listen to what their problem is, regardless, without being judgmental. We try to show empathy, to understand and relate to their feelings and their experiences. We want to be open-minded, and we want to use those words that shows comfort, and avoid being derogatory or offensive. We need to be open-minded, and we need to be receptive to feedback ourselves. We need to recognise and appreciate the contribution and achievement of others. We should be supportive and offer help when needed. We need to practice inclusive care. We need to be mindful of cultural differences. We need to foster a collaboration of working. We need to be reliable and consistent with our actions, and we need to lead by example with a positive tone. We also need to be able to be adaptable, reliable, and consistent. So when we talk about being adaptable, we need to embrace change. We need to be open to new ideas. And we need to demonstrate that flexibility of learning things and trying things in a different way. We need to be reliable. We need to fulfill our commitments and deliver on what we say we're going to do. And we need to be punctual and meet those deadlines when we do it. And we need to be consistent. We need to maintain a high standard of performance and work quality, or quality of work. And we need to treat everyone fairly. So I'm not going to give a whole lecture on treating people around dignity and privacy, because I expect you to know this. But again, just acknowledge their differences, their inherent, their cultural differences. Look at their uniquenesses and the characteristics that form them. But understand how health affects different people in different ways based on their cultural differences. So people more at risk, the genetic differences, etc. Be respectful, value their diversity, and look at their inclusion as well. So just taking on board the way in which you act in a professional manner, so following your code of practice. Respecting individuals' diversity, we know about the protected characteristics: race, ethnicity, gender, sexual orientation, age, disability, religion, and socio-economical backgrounds. We need to be respectful of people's beliefs and respect for diversities. We need to value and honour those, respect their religious and spiritual beliefs, which is a really important part of their health and care plans. We need to recognise that people have those unique characteristics, and we need to embrace that diversity. We should avoid imposing our own values and beliefs. We should allow individuals to express theirs and create safe spaces for them. When we talk about culture, this is what we create as an organisation and how we create a space as practitioners. And we need to create a culture which looks at valuing diversity. So therefore, we need to acknowledge and respect traditions and practices. We need to create an inclusive environment as well, feeling that we show that we're honouring and valuing people's valued and protected characteristics. We need to treat people with dignity and respect. We need to recognise those uniquenesses in and amongst everyone. And as well, when we look at valuing, we need to value and respect those differences and embrace diversity. Privacy, we need to obviously protect personal information. We understand this. We have our information governance, our GDPR. We have governance around data protection and communication. And we need to accept boundaries around privacy, but also we need to be able to have those difficult discussions, and we need to be able to provide space to manage those ethical dilemmas in which we face in an enhanced clinical role. We need to accept preferences, so lifestyle preferences. It's important to acknowledge and respect individuals' lifestyle choices, dietary needs, cultural preferences, including their work preferences, so what they do, the way in which they communicate with us, and other areas of their life. So creating those safe spaces in a non-judgmental way. B2 then looks at showing and respect empathy within the workplace. So as an enhanced clinical practitioner, we want to create a harmonious workplace. I'm not saying that right, but we know what we mean. I need to create a positive and supporting work environment. And that's thinking about how we foster that in such a stressful, challenging environment. So sometimes that's us stepping back, taking a breath, looking at how we manage conflict, but equally listening to how people communicate with others and drawing a culture around a humanious workplace. Apologies. We need to look at how we can be productive and how we can and create a positive work environment. So how we motivate people, how we look at job satisfaction, and how we're part as an enhanced role, being responsible for creating that culture and that environment. We need to show how we respect one another and work within that positive environment and demonstrate empathy from a top level of emotional intelligence down. So showing respect is about working with others in a place where we're treating colleagues and we're being considerate to their needs. We're being polite in communication. We're showing those active listening and we're acknowledging their ideas and their opinions. Empathy, I'm sure we all understand what empathy is, but it's about being understanding and sensitive. It's about offering support. It's about responding with compassion, about trying to put yourselves in their shoes and recognizing the difficulties in which one person can challenge or be challenged with. And we need to think about the benefits of showing respect and empathy. It creates that positive work environment where we feel safe and we're able to be ourselves. It fosters that positive working relationship where we're working towards our common values and goals as an organisation. And it shows that we value and respect each other, and that tends to lead to higher job satisfaction, motivation, and overall well-being. And finally, when we look at B3 about being adaptable, reliable, and consistent, here we need to be open to change. We need to not say, but I've been doing it this way for a long time. We need to know what the current evidence is. We need to understand that circumstances change. And actually, if we think about personal-centered care, do policies and procedures allow us to be personal-centered? And interestingly so, I was in a meeting not that long ago where a local authority have now got a policy not to have a one-size-fits-all policy. And what they're saying by that is, look, yes, we have policies, but they're more guidelines than policies. And that as professionals, we need to be given professional judgment, because policies can indirectly discriminate. Policies can stop us working in somebody's best way. And we need to have the courage to say, this doesn't work for this individual. We need to be flexible and we need to be on our continual learning journey, and which you are, that's why you're on this program. And we need to have a positive attitude. We need to remain somebody that is there and enabling to embrace change. And to be reliable, and this is what I assess you against, you need to be fully committed. If you say you're going to do something, you need to do it. You need to be able to meet deadlines. So each month you need to make sure that you're just getting this work in. It's not like your university work where it's really labour intensive. I just want reflective work on how you're implementing this within your role. You need to be able to build trust, which you do if you're committed and you meet deadlines. You need to be responsible, so making sure that you work within your levels of what you're comfortable with. You need to be trustworthy, and you need to think about that consistency. So being consistent means that you are maintaining a steady and predictable pattern of behaviour, performance, and communication. So thinking about contributing to a trustworthy and dynamic environment, you need to be adaptable, reliable, and consistent. All the words that we've used, you need to demonstrate that trustworthy and show that you can be depended upon. So, in month one, we've gone through the PowerPoint. I've created you a handbook or a little guide that you can print out and use just to help with your notes. So you don't need to take notes, I've taken them for you. And you may find this useful towards your endpoint assessment. If we click next, we've just covered these three, which is about treating people with dignity, showing respect, and being adaptable, reliable, and consistent. Again, a bit more writing about what those are. Depending on what type of learner you are, you've got it there in written terms. And I've given you examples. So if you're a social worker, a nurse, or a mental health practitioner, how those may look to you under those different professions. Again, about showing respect. I'm not going to read this to you because this is for you to read, and about being reliable and consistent, that's for you to read. And there's a little summary there. And what you then have at the end of each module is you have your recommended reading, websites, and extended work. Once you've done that and you get to the end of your module, you will find that you have an assignment to do. So here it says, describe a situation where you had to work with a patient at college whose belief cultural differences were different to your own. How did you ensure you treated them with dignity and respect while still providing them with the support that they needed? How did you show respect and empathy for this? And what steps did you take to be accountable, reliable, consistent for care? Finally, what did you learn from this experience, that reflective piece? Now, let me just show you what this looks like from your side. So when you're in here, you hit next. Oh, hang on. It's because I've gone to student view. I need to flick through to the assessment. If you ever get lost, go back to home. And then you can go back in. Oh, there you go. So we're here on behaviours. So one thing is you can't skip a part. You have to go through each of the module, read it before it will let you do the assessment. So a lot of people go, oh, it's not working. I can't get to the assessment. And it's because they've skipped a page or not clicked on it. So it won't move forward from a student point unless you've done that. Okay, so here we are. So to describe the situation, there's your assessment, 500 words, plus or minus 10%. So that's up to you if you do that. You have 2 attempts on this assignment. Ideally, it should be Harvard referenced, which you should be used to, and you hit start assessment, and you literally just copy and paste that in there. So Let me show you how to do that. If you go to ChatGPT, you pop that in there. We want it writes up our essay. Now, obviously, I'm going to know if you've used this because what this doesn't know is the home that you're in. It doesn't know the example that you're going to give me. So you obviously have to write it. Now, what you can use ChatGPT for is some referencing, or you can use it to give you an idea. So you can see here, this hasn't Harvard referenced this at all, so it's not an appropriate. It's some of my reference, but it has on the insight referencing. So we'd know, please rewrite with insight reference or right. So hopefully that will produce it. There you go. So it's now added the insight referencing. So if you need it to check your referencing, etc., you can use it for that. That's absolutely fine. I've got no problems with that. There. So once you've written this and you've written your 500 words, and the words in there is the word count is a guide. You're not going to be losing marks from me if you haven't done that. So all you're going to do is you copy and paste your work in, and that's fine. Now, I'm not going to worry about the layout so much here because it's very difficult, but yeah, it doesn't actually even give us the square one, so that's fine. I'll accept that. And you just hit next. Once you've done that, it should, oh, it should just come up with a little celebration with party balloons and stuff, and it will show that it's submitted. And you can see you've got your ticks on there. What will then happen is it's graded, so you can go to your grades. There's that first one we've submitted, so you're waiting for our feedback, and you can download all your grades there. People who is in your cohort, discussions and announcements are there as well. So everything you need is there. And again, under files, you've got your course books there if you want your course books. So that's all the books there that you can download. So it's all there ready for you to start. So that's month one for behaviours. Each month, it will be the start of the month that it's ready. So around the first of each month, the next module will have the recordings, and the recordings will be here. So it'll be the first tab, and you'll see that on there. Lovely. Well, hopefully that's given you an idea of what's going on. Remember, for the first 3 months, you're going to be doing month one, month two, and month three. So you're going to have to do those alongside your CPD certificate. So please make sure you keep up to date with everything. Okay. If you've got any problems, you can send me an email by clicking on the message box here. Wonderful. I wish you all the best of luck. Take care, and we'll talk soon.